Welcome to our channel. Today we're going to discuss about the Escherichia coli, and we are just starting. That is the new series. That is the basics of microbiology series. You need to just subscribe our channel. You will get notified about every kinds of classes, and if you are to subscribe our channel, you will get the regular free classes into our YouTube channel. That is completely free of cost, and we are just belonging in the basic of microbiology series, as we have covered 2 or 3 classes. Today is the 4th class that we are covering the Escherichia coli. Hopefully gradually we will cover every kinds of bacteria, and after completing this class you will get a roadmap in which methodology we are understanding the every kind of bacteria. I will teach you how to you learn the bacteria, how to every kinds of thing you can capture in a very easiest manner, so that the microbiology you can understand in very easily. Don't think that the microbiology is a very compact things. That's a very easy things. After completing this class you will understand it, and if you are just attaching with us and attaching with our platform, you can understand that how our way of teaching is, as well as which kinds of materials we are providing to the students. See, whenever we are understanding the bacteria, firstly we need to understand that in which family they are belonging. See here, they are belonging into the Enterobacteriaceae family. Getting my point? Almost gram-negative bacillus, they all are belonging into the Enterobacteriaceae family. If I am saying that, that is the Escherichia coli, that is the Klebsiella, that is the Salmonella, that is the Shigella, they all are belonging into the particular family. Understood? After that, see here, facultative anaerobic means anaerobic, defining that they does not require any kinds of oxygen. But here is a terminology. If you are noticing here, the terminology that basically facultative, it defining that with oxygen they can also grow, because they are facultative, they are not strict. Understood? After that, see here, they basically normally found into the gut flora of human as well as animal. Okay, they are normally found into our body because they have some good E. coli. They basically helping to the digestion. They are not occurring any kinds of pathogenic things, but sometimes they are opportunistic pathogen, means they can causes the disease, they can causes diarrhea, they can causes UTI, they can causes various type of pathogenesis or pathological disease. Okay, that's are the very basic introduction of Escherichia coli. If you are seeing here, here is a 3D drama or 3D diagrammatic form of the Escherichia coli. Just see here, it's a very HD picture, so that you can just take a overview how it look like. Okay, I'm moving to the next slide. See, now we are coming to understand that how the Escherichia coli look like. I have to change the pen so that it will give me the another vibes, as well as you can understand it properly. See, first one is the general characteristics we need to understand. See here, general characteristics means which kinds of basic character are founding into the Escherichia coli. I am again saying you that not only Escherichia coli but also every kinds of bacteria, you need to find out this kinds of category, is it present or not. Firstly, you need to understand that is it gram positive or gram negative. We have already understood that that is the gram negative bacteria. After that, we need to understand that is it spore forming or not. See here, they are not spore forming. See, they are non-spore forming. Thirdly, you need to understand that is it capsulated or non-capsulated. See here, they are non-capsulated. Getting my point? Fourthly, you need to understand that they basically founding where? See here, intestinal tract of human and animal. Understood? And the fifth things you need to understand that is it motile? If motile, which kinds of flagella basically present? because the motility comes from the flagella. Yes or no? Without flagella, the bacteria cannot be motile. So that whenever we are coming that it's a motile, then you have to understand that which kinds of flagella basically present. They are present the peritracheous flagella. We have already understood into the basic classes of bacteriology that what are the arrangement of flagella. There have the peritracheous flagella, there have the amphitracheous flagella, there have the lymphotracheous flagella. Okay, we have already understood that. See here, that is a peritracheous flagella basically present. See, and to the surroundings of the bacteria, the flagella basically present. Got it? Now I am coming to, is it sad, is it cocky or basically? I have already told you that it is bacillus. Okay, 1.1 to 3 micrometer, that's the length, and 0.4 to 0.7 micrometer, that is the width. Okay, that's all are the Escherichia coli. If you are just coming here, that is the generalized picture of the Escherichia coli. See, that is a basic general picture of a bacteria. See, here is present the flagella, here is present the cell wall, here is present the plasma membrane. If you are understanding that there should be present the periplasmic space because it's the gram-negative bacteria. Got it? After that, there should be present the ribosome, which basically help to which synthesis? Say me, which synthesis? That is the protein synthesis. Got it? And then there have also the cytosol. Okay, that's all are the very basic things as well as the basic characteristics as well as the basic structure of the Escherichia coli. Hope you have already got a general idea how the Escherichia coli look like. Okay, and there have also flagella, which basically help to the conjugation. Conjugation means whenever they are attaching with another bacteria, this pili basically help to transfer the genetic materials from here to here, from one bacteria to another bacteria. Okay, that is called transduction also. Got it? See, after that we are coming to the next slide. Hope the thing is clear. See, we are understanding that culture characteristics means that we have already understood the basic characteristics of the Escherichia coli. We have already understood the morphology of Escherichia coli, means how they look like. Now we need to understand that where they are grow. We need to understand for growing any kinds of bacteria, we need to just, I have to change my color of the pink. See, so that we need to understand that which kinds of culture media basically uses to cultivate or to grow the Escherichia coli, because without the culture media they are not grow, or without the culture media bacteria cannot grow. Yes or no? Right? See, they grow in the for 18 to 24 hours at 37 degrees centigrade. It is the basic environment of the bacterial growth. Understood? Now here I have mentioned only 3 culture media name. There have also lots of culture media like UTI agar Escherichia coli may grow, like clade agar E. coli may grow, okay, like nutrient agar Escherichia coli or E. coli may grow. But here I have chosen the most important agar who are required to growing the Escherichia coli. First one is the McConkey agar. Second one, see here, that is the EMB agar. Okay. Third one is the liquid media like turbid growth. Whenever we are using any kinds of broth, see here, broth should be in liquid. Yes or no? Broth should be in liquid, so that whenever any kinds of broth we are giving, taking, we will get that the turbidity might be formed. This turbidity are defining that the Escherichia coli are present to the particular broth, okay, or to the particular specimen. See here we are getting the McConkey agar, because McConkey agar one type of differentiate media. Yes or no? And as well as McConkey agar, we can say that it is also the indicator media, right? So that there is so we can easily detect that is it lactose fermentation occurring, yes or not. But into the case of Escherichia coli, lactose fermentation should be occurred. See here, lactose fermentation should be occurred. So that we have already understood the cultural characteristics. You just need to take some basic agar's name, and in which agar which kinds of signs or which kinds of indication we are occurring, we just take a very basic idea. Got it? See, here is a also picture of a agar. We have taken the picture, that is a Escherichia coli. Got it? Escherichia coli, that is also agar. And there is a, see here, there is a lactose fermentation are occurring. Lactose fermentation giving the pink color. If I am choosing the another pen, see here, if I am choosing the highlighter, see here, this lactose fermentation are giving, that is a, see here, lactose fermentation are giving, that is pink in color. See here, that is a pink in color. Got it? Now I am coming to say biochemical test. Which kinds of biochemical tests are present? We need to take the idea. See here, biochemical test defining that there have some kinds of tests, there have some kinds of test, or there have some kinds of reaction we are doing to identify any kinds of bacteria, that is called biochemical test. As I will take a class of biochemical test, don't worry, just stay tuned with our channel. You will get the classes of biochemical test. There have also lots of biochemical tests. Firstly, I am saying you that I am just saying you the name. See here, here is a defining into two way. First way, defining that what are the positive biochemical tests, and the second way, here I am mentioning which kinds of tests negative. See here, beside these kinds of tests, there have also lots of biochemical tests. But into the case of Escherichia coli or E. coli, we have to do only this test. See, first one is the glucose test, that is a glucose positive. Acid formation are occurring as well as gas formation also occurring. Got it? Second one is a lactose test, that is also positive. Third one is a mannitol test, that is also positive. Indole is the widely used biochemical marker, because whenever I will take the class of Klebsiella, then you will understand that the E. coli and Klebsiella, they have nothing difference. Only one difference that E. coli is motile and Klebsiella is immotile. Okay, and we have to do the indole test for identifying or for differentiate the E. coli from Klebsiella. Got it? Because Klebsiella basically indole negative. Hope the thing is clear. Indole negative, and the Escherichia coli, that is the indole positive. Got it? And urease, that is negative. Sucrose, that is also negative. Citrate, that is also negative. MR, methyl red, that is also negative. BP, bogus prosperous, that is also negative. Okay, that's all are the biochemical tests. We have already understood that what are the positive biochemical tests and what are the negative biochemical tests, so that we have already covered the 60% part of the Escherichia coli. I am again saying you that I will give you the basic full comprehensive overview of the Escherichia coli, so that you can, after completing or after attending this class, you can take a very elaborate idea regarding Escherichia coli, and that will help you into every kinds of aspect. See, here is also I have mentioned the picture. See, there is the picture of Escherichia coli. Sir, we have already lots of times seen the Escherichia coli. How to we seen it, as well as what will we do to see it again? See, here have the twist, dear. Here have the twist. See, there have some antigen. Which antigen basically the pathogenic antigen might be occur. There have basically 4 type of antigen. See, O antigen basically belonging, or if you are noticing that their O antigen are belonging into the somatic. Okay, O antigen is called somatic antigen, or we can say that they basically founded into the cell wall. Okay, that is a somatic. After that, sir, there have also another antigen. Hope the thing is clear. Got it? See, that is the H antigen. H antigen defining the flagellar antigen. See here, sir, see here, that is the flagella. These flagella are belonging the H antigen. There have also F antigen. F antigen is the fimbrial antigen. Okay, and H antigen we have already understood. So that there is the O antigen we have understood. There is the rest part of the antigen, that is called K antigen. If you are just doing the pronunciation K capsule, K capsule, K capsule, so that K antigen defining the capsular antigen. Here is a tricks to memorize. F fimri. See, F means fimri, and O defining the round shape defining the surroundings of the bacteria. You may memorize like this format. Okay, O antigen, that is a somatic antigen. Hope the thing is clear. Now I am coming to the virulence factor. Sir, what do you mean by virulence? What are the virulence? Virulence defining that whenever the disease are occurring or disease creating capacity. Virulence defining that how the toxicity will be occurred, how the severe the disease will be occurred, how the persistence of the disease might be occurred. That basically defining the virulence. Sir, we have understood the virulence. Now what do you mean by factor? The factor defining that which kinds of things basically elevated the disease level, which kinds of things are basically to elevated the persistence of the disease, which kinds of things basically to increasing the pathogenicity of the particular disease. That is called virulence factor. Got it? So that whenever we are coming to the virulence factor, see, these kinds of whole kinds of antigen are virulent. Got it? They are also the virulence factor. Second one is a toxin. There have also heat liable toxin, that is the LT. There have also heat stable toxin, that is the ST. There have also virotoxin. There is also hemolysin. They all are the toxin. After that, another one factor is also there, that is a pili or fimdial factor. Pili basically help to the adhesion to the epithelial cell. I have already told you that. So that we have already covered the things regarding the antigen, regarding the virulence factor. Hope the thing is clear. Now I am moving to next slide. Okay, see, it's a very important topic in the aspect of the Escherichia coli. If you are noticing here, see, they basically causes the diarrheal disease. Got it? Rather than the diarrheal disease, there have also lots of disease, but in the aspect of the diarrheal disease, this Escherichia coli have variant type of variety. See, first one is the enteropathogenic Escherichia coli. If you are noticing here, that is a EPEC, enteropathogenic Escherichia coli. This basically causes the inflammation and degeneration of the enterocyte of epithelial cell. Understood? After that, second one, sir, see here, enterotoxigenic Escherichia coli. See here, that is the enterotoxigenic Escherichia coli. See, enterotoxigenic, they basically produces the toxin and leading the travelers and childhood diarrhea. This is the very important question. Various type of competitive exam basically asks this question. Okay, if you are taking preparation or wanna take the preparation, then you might check our description box. There have mentioned every kinds of paid batches of our particular platform. See, that is a traveler's diarrhea. Okay, traveler's diarrhea basically caused by the ETEC. Okay, enterotoxigenic Escherichia coli. Now, sir, we have understood EPEC, we have understood ETEC. Now, please come with me. That is the IEC, intero-invasive Escherichia coli. Intero-invasive, they basically causes the dysentery caused by the Shigella. Okay, after that, see here, that is the enterohemorrhagic Escherichia coli, EHEC, enterohemorrhagic Escherichia coli. They produces the virotoxin. Okay, they produces the virotoxin. That is also important. If you are noticing here, they produce the virotoxin. After that, see here, if you are noticing here, that is the enteroaggressive Escherichia coli. They basically aggregate the stacked brick-like pattern. Okay, producing the EAST1 toxin. Got it? If you are understanding, or if you want to take the more knowledge, then you have to just join our classes, as well as is into our PX classes. You will get the whole PDF notes of these kinds of whole bacteria also. Got it? Because that is a basic class, so that we cannot elaborate in a very high much manner. Okay, see, after that, the diffuse adherent Escherichia coli, DAEC. Okay, that's all are the types of or diarrheal type of the Escherichia coli. EPEC, ETEC, EIEC, EHEC, and EAEC, and DAEC. Got it? And if you are noticing here, every variant are contains with EC. Got it? Because every variants are from Escherichia coli, so that every variant contains with E. coli. Got it? See here, diverse strain and diarrheal disease. I think the particular thing is clear. Okay, now we are moving to the Next slide. See, that is the disease cost. We are already ending stage of the particular session. See here, that is the disease. I have already told you that Escherichia coli basically causes the UTI, urinary tract infection. That is the kidney, yes or no? That is the ureter. Okay, that is the ureter, and that is the urinary bladder. That is the urethra. So that is called urinary tract. Whenever the infection are occurring into the particular tract, that is called UTI or urinary tract infection. Got it? See here, after the diarrheal disease. Got it? Diarrheal disease, I have already told you that the travelers diarrhea, children's diarrhea, there have also another type of diarrhea. After that, this Escherichia coli also causes the neonatal meningitis, means inflammation of the meninges. Okay, K1 antigen strains basically occurring. After that, spectemia defining that whenever the bacteria are spread into the whole body, not only persist but also growing into the whole body, that is called spectemia. Got it? High mortality in the diabetic patient. Okay, after that, wound infection might be occurred. After that, peritonitis might be occurred. After that, cholecystitis might be occurred. This defining that, see here, it is defining that the inflammation. Hope the thing is clear. Now I am coming to say that is a laboratory diagnosis. How do we do? We have already told you that. I have already explained the particular things. Firstly, you have to take the specimen. Okay, after that you have to do the culture. Okay, after that you have to do the biochemical test. After that you have to do the stain, and into the stain you will get the gram negative facility. Okay, after that, if any kinds of higher examination is required, or if any kinds of severe case, then you may go to the PCR or ELISA. Okay, that is a toxin detection. So that I have already told you that you have to collect the specimen, you have to do the culture, see here, culture. After that you have to do the stain. Got it? You have to do the stain. After that you have to do the biochemical test. I have already told you that you may do the biochemical test also. After that, last one is the microscopy. Within the microscope you will get the gram negative facility. Okay, that's all are the basic lab diagnosis. And the Escherichia coli, one of the most pathogenic bacteria for UTI, as well as into our routine lab, microbiology laboratory, 80% cases you will get the Escherichia coli, and 80% cases you will get Escherichia coli and Klebsiella. Klebsiellas prominency is less, and the E.Coli's prominency is high. Okay, so that 80% cases of microbiology you will get the Escherichia coli. Okay, so that it's a most prominent bacteria into our routine microbiology laboratory also. Got it? So that we have already just ending stage of the particular lecture, we have already understood everything: structure, culture, biochemical test, variant. After that, antigenic structure. We have already understood everything regarding the Escherichia coli disease condition. After that, we have understood the lab diagnosis. Now it's a high time to discuss about the treatment and prevention. That is the ending stage of today's lecture. If you are understanding the particular things, or if you are enjoying the lecture, then you have to do the like, then you have to do the subscribe, and then you have to attach with our platform. See, a treatment that is uncomplicated. If it's uncomplicated, then you may suggest the nitrofurantoin, then you may suggest the phosphofosamine, then you may suggest the TMP. Okay, and there have also another type of drug. I will say you that colistin is now banned. Colistin are not suggested. Okay, after that, amikacin, it is also important drug for Escherichia coli also. After that, phosphofosamine, I have already told you that. After that, see here, ciprofloxacin. Whenever it's a complicated, then we may suggest the ciprofloxacin. After that, ceftriaxone. Okay, after that, gentamicin, it is also important. Okay, after that, in case of the diarrhea, see here, we may suggest the ORS with erythromycin or ciprofloxacin. Got it? And if that is a enterohemorrhagic Escherichia coli, that does not require any kinds of antibiotic. Okay, if neonatal meningitis, then you may suggest the ampicillin and gentamicin. I am again saying you that treatment is not our part. We have to just do the culture and sensitivity test into the part of lab diagnosis. Then you may easily get which kinds of antibiotic is sensitive and which kinds of antibiotic is resistant, right? And what are the sensitive drag, you have to give to the report to the particular microbiologist, then they will pick up few antibiotic and suggest to the particular patient. Got it? And how do you prevent the Escherichia coli? You have to do the hygiene properly. After that, you have to use the water and food properly. Avoid the undercooked meat. Okay, avoid the probiotics for the gut. Use the probiotic for the gut health. Okay, we may suggest some probiotic means these kinds of agents are help to resist the bacteria, as well as these kinds of agents will help you to taking precaution of the bacteria, so that bacteria will attack, they will not become as well as they cannot do the harm to our particular bacteria or to our particular body. That is called probiotic means you have to taking the precaution before entering the bacteria. Got it? After that, prophylaxis antibiotic, travelers diarrhea at risk. Okay, see, that's all are the prevention technique you have to maintain. Okay, I hope that the whole thing is clear now. Thank you so much for attending the class. Just check the description box for paid classes. We have our own ebook, we have our own notes, we have our own one liner, we have our own tables, we have our own ebooks also, lots of, so that you have to just check the description box. There have lots of services are available from our platform. You have to just check it out. Okay, thanks a lot for joining the class. Into the next class we will meet again. Thanks a lot.